So my name is John Capua. This is Dong, Taylor, and Davis, and we are PT partner. So let's just jump right on into it. So total knee arthroplasty is one of the most performed orthopedic procedures in the United States. And if current utilization trends continue, we're going to have a very large population of patients who receive total knee replacements in the near future. And this presents a potential problem because if we look at if we compare total knee replacements to total hip replacements, which are similar surgeries in terms of difficulty, we actually see that total knees have twice the 5-year chronic pain complication rate in comparison to total hips. And this difference in complication rate is largely due to adherence to high-quality physical therapy. So physical therapy has been shown in literature to improve functional outcome and reduce chronic pain. However, the effectiveness of physical therapy is largely based on a therapist's ability to evaluate if a patient is performing their home physical therapy, first performing and then also performing it adequately at home. And that's where our device comes in. So we created a device, and the main component of our device is 3 gyroscopes, which are placed above the knee, below the knee, and below the patient's ankle. The device, which interfaces with the phone application, records if a patient is performing their physical therapy and also records how well they're performing it. So we actually laser cut the enclosure that we're going to use for our device, and you can see it's here on the patient's brace and foot. And these are the actual electronics that we plan to use in our device. So the real value with our device is that it solves the problem of physicians being unable to track a patient's performance of PT at home. Additionally, if a patient isn't meeting certain milestones, for example, if they're not meeting certain range of motion milestones during their therapy, the application will alert the physician of that in real time. So we think that's a really great advantage of the device.
Okay, now we're going to have a demo. Okay, let's go. So when the patient starts, they're introduced with all the exercises for the day. We're going to go over one of them. So for each exercise, we have a description of what's involved, along with photos to show patients how to properly do these exercises. And what's unique about our device is that it'll be able to track the range of motion while the patient is performing each exercise, making sure that they're going through the full range with the proper amount of reps and with the complete amount of sets each day. And this information will be given back to patients and physicians to help them track range of motion over time, as well as other metrics of healing, such as total steps per day. And all this can be exported to physicians as health metrics.
Thanks. So we plan to market this device to healthcare providers. As we all know, the American healthcare system is switching more and more to a value-based payment structure. And as part of that, CMMI has started paying for the vast majority of the TKAs that they pay for through a bundled payment model. And that is one bundled payment that includes pre-op care, the surgery itself, and anything that happens for 90 days after the surgery. So providers are now on the hook for faster recovery times for their patients and also lower complication rates. Just one example of these potential complication rates, almost 5% of patients who get TKAs end up needing manipulation under anesthesia, which takes OR time and costs thousands of dollars. So this will save money for healthcare providers by providing fewer complications, such as MUA as one example. Patients will be less likely to need intensive physical therapy if they have high-quality physical therapy at home, and that's more money saved for the healthcare providers. And patient satisfaction is now increasingly linked to reimbursement, but it's also heavily correlated with quality of care. So we think this will save providers a lot of money and help patients get a lot better. Thank you.